You wake up before the alarm. Your tongue feels stuck to the roof of your mouth. You reach for the water on your nightstand before your eyes are even fully open because you already know what's waiting, that dry, cottony feeling that makes it hard to swallow, hard to talk, sometimes hard to fall back asleep. You take a sip. It helps for a minute. Then it doesn't. Maybe you've started keeping a glass of water by the bed every night. Maybe you've tried chewing gum before bed. Maybe you've just gotten used to it. The way you get used to a lot of things after 60, the aches, the slower mornings, the little inconveniences you've quietly decided are just part of getting older. Here's what I want you to sit with for a moment. That dry mouth almost every morning isn't just a nuisance. For a lot of people, it isn't really about the mouth at all. It's your body pointing at something else, something often hiding in plain sight, in your medicine cabinet, in your bloodstream, or in the way you're breathing while you sleep. And here's the part almost nobody realizes. It's usually not one single thing. It's 2 or 3 smaller things quietly stacking on top of each other until the result is impossible to ignore. Keep that idea in your back pocket, because we're going to come back to it. Most people never make that connection. Their dentist tells them to drink more water. They try it, and a few weeks later, they're right back where they started, wondering why nothing helps. By the end of this video, you'll understand why that is and what you can actually do about it. I'll also give you one thing to check tonight before you even fall asleep that will already start narrowing down your answer. I've spent years working with patients well past 60, many managing several health conditions at once, many taking more than one medication a day. Dry mouth is one of the most common things they mention, almost as an afterthought, tucked in at the end of an appointment about something else entirely. And almost every time, once we dig a little, we find a real identifiable reason. Your salivary glands don't switch off on your 60th birthday. Something else is almost always going on, and once you know what to look for, it's often something you can actually do something about. Here's what we're covering together. What's actually happening inside your mouth when saliva production drops? The surprising list of everyday medications that are often the real cause, including some you may be taking right now without ever connecting the dots. Why dry mouth can be an early clue about blood sugar problems, sometimes before a person even knows they have one. How something happening while you sleep, something you'd never think to blame, might be drying you out every single night. And a simple way to start figuring out, on your own, what might be behind yours, along with exactly what to bring up with your doctor or pharmacist. I want to be honest with you before we go further. This isn't about scaring you. Dry mouth is common, and in most cases, the underlying cause is manageable. But your body doesn't usually raise its hand for no reason, and I'd rather you understand what yours might be trying to tell you than have you miss something worth paying attention to. Let me introduce you to someone who reminds me a lot of the patients I've worked with. I'll call him Frank. Frank is 68. He taught high school shop class for 31 years before he retired, and these days he spends his mornings in the garage building furniture for his grandkids. He lost his wife, Carol, 3 years ago and lives alone now in the same house where they raised their 2 daughters. He's the kind of guy who doesn't complain much. If something bothers him, he tends to just work around it, which, as you'll see, is exactly how this story started. About a year ago, Frank started noticing that dry, sticky feeling every morning. He assumed it was the cup of coffee he liked before bed, an old habit Carol used to tease him about. So he started keeping a water bottle on his nightstand. It helped for a night or two, then the dryness came right back. Some mornings he stopped looking forward to that first cup of coffee altogether, because even the first swallow felt uncomfortable, like his throat had to work for it. He had no idea that something was already happening inside his mouth, and as it turned out, inside his airway every single night without him ever noticing. We'll come back to Frank soon, because what his dentist found next surprised even him. Let's start with the basics, because understanding what saliva does for you changes the way you think about losing it. Every night while you sleep, a thin, steady layer of saliva quietly coats your mouth, almost like an invisible shield. It washes away leftover food particles. It neutralizes acid before it can eat into your teeth. It carries minerals that help repair your enamel while you sleep. It keeps the soft tissue in your mouth moist enough to resist infection. It's not glamorous. Most of us never think about it until it's gone. Dentists have known for decades that reduced saliva dramatically increases the risk of cavities and gum disease. It's one of the most consistent findings in oral health research, which is exactly why a change in your saliva shows up in your teeth long before it shows up anywhere else. When saliva production drops, that shield thins out. Bacteria that would normally get washed away start to build up instead. Acid lingers longer on your teeth. Your gums lose some of their natural defense. So the real question isn't, why is my mouth dry? It's, what is stopping my body from making the saliva it's supposed to make? For a huge number of people, the answer is sitting in their medicine cabinet. Before we get to that, here's your one observation for tonight, the first small step. When you wake up tomorrow, notice two things. Is the dryness worst right when you wake up, or does it linger all day? And is your mouth dry, or does your whole body feel dehydrated? That single distinction, a dry mouth specifically, versus general dehydration, already starts pointing you toward the right explanation. Hold on to that answer. We'll use it later. Here's something that surprises almost everyone I explain this to. There are more than 400 commonly prescribed medications that can reduce saliva production as a side effect. Not exotic drugs, everyday ones. Medications for high blood pressure, allergies, depression, and overactive bladder all make the list, along with some over-the-counter sleep aids and antihistamines. Here's a fact that tends to stop people in their tracks. A single blood pressure medication taken exactly as prescribed can leave your mouth drier overnight than if you'd barely had anything to drink all evening. The dryness isn't coming from a lack of water. It's coming from a chemical effect on the glands themselves, and no amount of sipping from a nightstand glass will fully undo it. It's easy to see why nobody connects the dots. You start a new blood pressure medication because your doctor is worried about your heart, not your mouth. Nobody hands you a pamphlet that says, by the way, this might leave you waking up parched. The dryness creeps in slowly over weeks or months, and by the time you notice it, it just feels like background noise, something you got used to instead of something you should ask about. Diuretics, muscle relaxants, and medications for nerve pain round out the list, and so do several prescribed for anxiety. None of this means your medications are wrong for you. It just means dry mouth deserves a place on the list of side effect questions you ask, right alongside, what else should I watch for, instead of being treated as an afterthought. This is where I always encourage patients to think a little differently. If your dry mouth started around the same time as a new prescription, or got noticeably worse after a dosage change, that timing is a clue worth paying attention to. It doesn't mean you need to stop taking anything. It absolutely does not mean that. It means it's worth a conversation with your doctor or pharmacist, who can look at your specific medications and tell you whether that's a realistic explanation for what you're experiencing. Frank, as it turned out, had started a second blood pressure medication a few months before his dryness began. He hadn't thought to mention it to anyone, because as far as he knew, it had nothing to do with his mouth. That's how quietly this piece of the puzzle usually hides. And medication is only one piece of this puzzle. There's another possibility a lot of people never consider, and it has nothing to do with what you're taking and everything to do with something happening while you're completely unconscious. If you've ever woken up and noticed your mouth was dry specifically, not your whole body feeling dehydrated, just your mouth, there's a decent chance you were breathing through it for at least part of the night. Chronic mouth breathing during sleep is one of the most overlooked causes of morning dryness in people over 50. Sometimes this is as simple as nasal congestion, allergies, or a slightly blocked airway that worsens when you lie down. But sometimes it points to something more significant, sleep apnea, a condition where breathing repeatedly stops and starts throughout the night, often without the person ever realizing it's happening. Here's a detail most people find genuinely surprising. One of the most common early clues that gets mentioned to me isn't snoring, and it isn't daytime tiredness, even though people assume those are the big warning signs. It's dry mouth, waking up parched almost every single morning like clockwork. In fact, dentists often notice the warning signs of sleep-related breathing problems, worn teeth, a scalloped tongue, chronic dryness, before a person's own physician ever does, simply because a dental visit is often the one time a year someone gets a close look inside the mouth. I want to offer some reassurance here because I know the phrase sleep apnea can sound alarming. It's actually one of the more manageable conditions we deal with in people your age. The tools available today are far more comfortable than what existed even 10 years ago, and once it's identified, most people see a real improvement, not just in their mouth, but in their energy, their focus, even their mood. The hard part usually isn't treating it. The hard part is realizing it's there in the first place, because the person experiencing it is asleep the whole time it's happening. Frank had no idea any of this was going on inside his own airway. Neither did Carol. All those years she teased him about snoring. Nobody thought to connect it to anything beyond being a little annoying at 2 a.m. There's a simple, low-tech way to get a hint about this on your own before you ever set foot in a sleep clinic. If you tend to wake up with dryness concentrated more on one side of your mouth, or if you notice your lips are dry but the rest of your face feels fine, that's often a sign of mouth breathing specifically, rather than general dehydration. It's not a diagnosis, only a sleep study can give you that, but it's exactly the kind of small detail worth mentioning to your doctor. The same way Frank's offhand comment about snoring turned out to matter far more than he expected. There's a third thing worth knowing, even though it's less common. For some people, especially women over 50, persistent dry mouth combined with dry, gritty feeling eyes can be an early sign of an autoimmune condition called Sjögren's syndrome, where the immune system starts affecting the glands that produce saliva and tears. Most dry mouth is not Sjögren's. It wasn't part of Frank's puzzle, and it likely isn't yours either. But it's rarely diagnosed from one symptom alone. It's the pattern that matters: dry eyes and dry mouth together, sometimes with unexplained joint discomfort. If that combination sounds familiar, it's worth mentioning to your doctor by name, since it's not something a routine dental visit alone would catch. Here's a number that tends to surprise just about everyone I share it with. A healthy person produces somewhere between half a gallon and a gallon of saliva every single day, enough to protect your teeth and gums and keep your mouth comfortable without you ever thinking about it. That's exactly why even a modest drop gets noticed almost immediately, and it circles back to blood sugar, which is relevant for a lot of people watching this. Researchers who study diabetes and prediabetes have long noted that dry mouth is one of the earlier, subtler symptoms that shows up before some people are ever diagnosed. When blood sugar runs high over time, it can affect the body's fluid balance and, for some people, directly reduce saliva output. It's often mentioned alongside more familiar symptoms: increased thirst, needing to urinate more often, feeling unusually tired but dry mouth on its own, sometimes appears earlier than the rest. Here's the surprising part. Some people notice the dry mouth for months, sometimes over a year, before anything else changes enough to make them suspicious. The mouth, in a strange way, can be one of the earliest messengers your body has. This one wasn't part of Frank's story. His numbers came back fine, but for plenty of people watching, it's exactly where the real answer turns out to be hiding. This doesn't mean everyone with dry mouth has a blood sugar problem. It doesn't work that way. But if you haven't had your blood sugar checked recently, and you're dealing with unexplained dryness, that's a reasonable, low-cost thing to ask your doctor about at your next visit. It's a simple blood test, and knowing early gives you far more options than finding out later. I've seen this play out more than once. A patient comes in convinced their dry mouth is just a side effect of their blood pressure pills, and it's true, that's part of the story. But a routine blood sugar test, ordered almost as a formality, comes back higher than expected, not diabetic, not yet, but heading in that direction. That's the value of asking one more question than you think you need to. It doesn't cost you anything to rule something out. It can cost you quite a bit to miss it. And notice what's happening there too. It's rarely one tidy explanation. It's a medication doing part of the work, and something else quietly doing the rest. You've learned quite a bit already, so let's take stock for a second. We've talked about how saliva protects your mouth, why medication is often the hidden cause behind dryness, how breathing patterns during sleep can play a bigger role than people realize, why an autoimmune condition can sometimes be behind it, and why dry mouth sometimes shows up before other, more obvious health signals do. Remember that idea from the very beginning, that it's rarely just one cause, usually 2 or 3 stacking together? Keep that in mind, because we're about to see exactly what that looked like for Frank. If any of this has been useful so far, it genuinely helps more people find this video when you take a moment to like it. And if you're not already subscribed, it means a lot. It lets me know this kind of information is actually reaching the people it's meant for. If a question has come to mind while watching, drop it in the comments. I read through them, and sometimes the best topics for future videos come directly from what people are asking. When Frank's dentist saw those 2 new cavities in a man who hadn't had one in over a decade, she asked him a few more questions than usual. How long had the dryness been going on? Was it worse in the morning or throughout the day? Had anything changed with his medications recently? Frank mentioned, almost in passing, that his doctor had added a second blood pressure medication a few months earlier, and that Carol used to joke about how loudly he snored, though he'd never thought much of it since she had been gone. His dentist connected 2 things at once. The new medication was a known contributor to dry mouth, and the snoring Frank had brushed off for years was a detail worth mentioning to his physician, not just a personality quirk. Frank went back to his doctor. They didn't change his blood pressure medication right away. His blood pressure was well controlled, and his doctor wanted to be careful not to disrupt something that was working. But she did order a sleep study, mostly because of that offhand comment about the snoring. Here's the part that genuinely surprised Frank. He had mild sleep apnea, not severe enough to have caused dramatic daytime symptoms he would have noticed on his own, but enough that he was breathing through his mouth for a good portion of the night, every single night, on top of a medication that was already reducing his saliva production. 2 smaller causes, stacking on top of each other, adding up to a problem that felt much bigger than either one alone. That's often how this works, and it's worth remembering. It's rarely just one thing. It's usually 2 or 3 smaller factors combining quietly until the result is impossible to ignore. Frank's water bottle on the nightstand had never stood a chance against 2 causes working against him at once. Frank started using a simple device at night, something far less bulky than what he'd imagined when his doctor first mentioned a sleep study. His doctor also adjusted the timing of one of his medications, moving it earlier in the day instead of at bedtime, which made a noticeable difference on its own. His dentist recommended a fluoride rinse in the meantime to help protect his teeth while everything else was being sorted out. It didn't happen overnight, but within about 6 weeks, Frank told his dentist something he hadn't expected to say. He'd stopped needing the water bottle by the bed most nights, and at his next cleaning, no new cavities. What stuck with Frank most, he told his dentist later, wasn't the device or the medication timing. It was realizing how long he'd been treating 2 real fixable causes as if they were just getting older. A year of dry mornings, 2 new cavities, and a running joke about snoring, all of it traced back to 2 specific identifiable things sitting quietly, waiting for someone to ask the right questions. Now let me walk you through how you can start thinking about your own situation, because I know a lot of you watching are trying to figure out which of these might apply to you. Remember that observation from earlier, whether your dryness is worst in the morning specifically, and whether it's your mouth or your whole body that feels dehydrated? Here's how to use it. If your dry mouth seems to have started or worsened after a new prescription or a dosage change, that timing is a real clue, and it's worth a direct conversation with your doctor or pharmacist about alternatives or adjustments. If you wake up dry specifically, more than you feel dry throughout the day, and especially if anyone has ever mentioned that you snore, that points toward how you're breathing while you sleep. And a conversation about a sleep evaluation is worth having. If the dryness has shown up alongside dry or gritty eyes, or joint discomfort you can't otherwise explain, mention that specific combination to your doctor, because it changes what they'll want to check for. And if you haven't had your blood sugar checked in the last year or so, unexplained dry mouth is a reasonable enough reason to ask for that test at your next appointment. None of this is meant to replace an actual conversation with your doctor. Think of it as a starting point, a way to walk into that appointment with useful questions, instead of just saying, "My mouth feels dry," and hoping they figure out why. I know what some of you are thinking, because I've heard it many times in my office. I already drink plenty of water, and it doesn't help. That's actually a meaningful clue in itself. When water alone doesn't fix dry mouth, it's often a sign that the issue isn't dehydration at all. It's something interfering with saliva production directly, which points back toward medication, breathing patterns, or an underlying condition rather than simply needing more fluids. Others tell me, "My doctor never mentioned this being a concern." That's understandable. Dry mouth often gets treated as minor, and in a short appointment focused on blood pressure or cholesterol, it's easy for it to slip past without much discussion. That doesn't mean it isn't worth bringing up yourself directly and specifically at your next visit. And some of you are thinking, "I've had this for years, so it can't be anything serious." I understand why that feels true, but the length of time something has been happening isn't actually a reliable measure of how important it is to address. Sometimes it just means the underlying cause has been quietly building for years without anyone connecting the dots the way it did for Frank. There's one more thing I hear a lot. "Isn't this just dehydration? I'll drink more, and it'll sort itself out." I understand the instinct, but think back to that observation I asked you to make earlier, whether it's specifically your mouth that's dry or your whole body. General dehydration usually announces itself in more than one way: a headache, dark urine, feeling sluggish. When it's only your mouth, night after night, that's a much stronger sign that something is actively interfering with saliva production, rather than your body simply needing more fluids. Before you decide which category you fall into and move on, there's one mistake I see people make over and over. They pick the first explanation that sounds plausible, a medication they already know can cause dryness, say, and stop looking any further. Remember Frank. If he'd stopped at, "It's probably the blood pressure pill," the sleep apnea would have gone right on quietly working against him, undiagnosed, indefinitely. The goal isn't to find an explanation, it's to find all of yours, because for most people past 60, there's more than one. Here's what I'd suggest you do, starting this week. Write down when your dry mouth tends to be worst morning throughout the day, or both, because that detail alone helps narrow down the likely cause. Take a look at your current medications, or better yet, bring the full list with you to your pharmacist and simply ask whether any of them are known to cause dry mouth as a side effect. If anyone in your life has ever mentioned that you snore, or if you often wake up feeling unrested despite a full night's sleep, mention that specifically to your doctor and ask whether a sleep evaluation makes sense. And if it's been a while since your blood sugar was checked, ask for that test at your next visit, especially if the dryness has been persistent. None of these steps cost much. None of them require you to stop taking anything on your own or make any major changes without guidance. They simply give you and your doctor the information needed to find the actual cause instead of continuing to treat the symptom with sips of water that only work for a few minutes at a time. One more small thing that helps in the meantime, while you're sorting out the real cause: sugar-free gum or lozenges can encourage your body to produce a bit more saliva on its own, and a humidifier in the bedroom can ease dryness that's related to mouth breathing or dry winter air. These aren't fixes for the underlying issue, but they can make the weeks in between a lot more comfortable while you and your doctor figure out what's actually going on. I want to leave you with this. It's easy to assume that everything that changes about your body after 60 is simply the cost of getting older, something to quietly accept and work around. But your body is remarkably good at sending signals when something needs attention, and dry mouth is one of the clearer ones. You just have to know it's worth listening to. The encouraging part is that in the vast majority of cases, once the actual cause is identified, it's manageable. A medication gets adjusted, a sleep issue gets treated, a blood sugar problem gets caught early enough to make a real difference. None of these are small victories. They're the kind of thing that can quietly improve how you feel every single morning for years to come. It's never too late to pay attention to what your body is telling you, and it's never a bad time to ask your doctor one more question than you plan to. Think back to Frank for a second. A year of dry mornings, 2 cavities he hadn't had in a decade, a joke about snoring he'd stopped taking seriously the moment Carol wasn't around to make it anymore. None of it looked urgent, day to day. Strung together, it was 2 clear, fixable causes that had simply never been asked about in the same room at the same time by the same person. That's really all this comes down to, not a mystery, just a question nobody had gotten around to asking yet. If this video helped you understand your own dry mouth a little differently, I'd genuinely appreciate it if you'd like it, and subscribe. It helps this reach other people who are dealing with exactly what you've been dealing with. And if you've noticed your own dry mouth pattern while watching this, I'd love to hear about it in the comments. Take care of yourself, and I'll see you in the next one.